me, so it's difficult. But she was taken to the hospital. They've had her in there. They've performed probably thousands and thousands of dollars of testing, and they have no idea today, and she's been there for 2 days. They have no idea what's going on with her. Simple symptomology that I was told. I was like, did they check this? Did they check this? Did they check this? She's like, yes, they checked this, this, and this. I said, well, what about iron? No, I don't think anybody checked my iron. Like, that was the first thought. Like, my first thought. Her symptom is low oxygen levels and high heart rate. That's anemia, people. That's textbook anemia. Your iron is what carries your oxygen. If you've got a good heart rate, but you're trying hard to make oxygen and you don't have enough iron to do it, that's the first thing. Now, I assume they checked this, and she just doesn't know. I hope that they've checked this. She's been there 2 days. I hope that
because they could Google it and find out.
Check this, right? But sometimes I feel like they get so wound up in the complexity of the issue that it's like, keep it simple, stupid. It's like, well, it couldn't possibly be low iron. Why not?
Right.
Let's check that first before we send her for a CAT scan and an MRI and a full blood panel and blah blah. I'm just like, I just don't get it sometimes. I don't get where the train of thought is.
They're practicing.
They are practicing. I had another situation. I had a cousin who at 27 had a heart attack. And he went in, and sure enough, he had a heart attack. And so he got badgered badly. What kind of drugs are you on? You must be doing drugs. Nobody 27 years old with a healthy body is going to have a heart attack. What are you doing? What have you been doing? You've been on crack cocaine? What have you been doing?
My.
Cocaine? What have you been doing? And he was like, honestly... And he looked him straight in the eye, and I know this guy. I mean, he's my cousin. He's the straightest arrow you would ever want to meet. He does not use any illicit drugs. Never has. Never has. Even when he was a teenager. He was the one, pointing fingers and telling you he's going to call the cops on you if he sees you partaking in anything. I mean, he's just that kind of fella. So for them to badger him and browbeat him and tell him he must have been doing this stuff was just idiotic. And instead of figuring out what it was, they spent like 2 days trying to convince him that he was a drug addict. And he's like, I just need to get out of here because you people are crazy and I don't know what you're talking about. Well, turns out he had a virus 3 weeks before, and it had been rheumatic fever, and nobody knew about it until finally I contacted him, and I'm like, did they check you for rheumatic fever? Because that can attack the heart tissue. There's other viruses. So they didn't exactly come up with rheumatic fever, but they did come up with, you have heart damage due to a viral infection. That was the underlying, that's what it ended up being. A virus attacked his heart, caused irreparable.
Irreparable.
Irreparable. I don't know where that came from. Irreparable damage to the heart. And that's what caused his heart attack. So it had nothing to do with
illicit drugs. And he had to go through
drugs.
all that other bullshit
I'm
to
like,
get to that.
Take off your tunnel vision for a minute. Jeez, oh, Pete. If he's saying to you, it is not this,
and
then
blood
look
work
elsewhere.
would have shown that, too. That's like thalassemia. So the whole time I was growing up, everybody knew I was Italian, and the pediatrician kept putting me on iron supplements.
Right. And thalassemia, by definition,
is iron treatable.
Right. Iron resistant.
And I found out when I was 30.
Excuse me. Oh,
27. Yeah. No, 30. I found out when I was 30 years old because a friend of mine, I told her I wasn't feeling good, and she said, "Are you Italian?" I said, "Yeah." She was a doctor, and she said, "Have you ever been tested for thalassemia?" They had to send the blood work to Ohio.
Yeah, because nobody around here does that. Isn't that goofy?
Well, I was in California.
Oh, nobody around there did that. That's goofy.
Yeah.
Like, it's goofy to me that...
And I grew up in Ohio.
Like, it's such a weird test. Okay, it's the same with T3. Okay, people go in with T4 or thyroid issues, and they test the T4, and then they test the TSH, and they don't test the T3. And the T3 is where it's at.
Why wouldn't you do a full spectrum?
I have no idea, but you go in there and you ask them for some odd test that they never have performed, and they're like, well, we don't know what to do with that. We're going to send you to Covenant. don't know what to do with that. It's a normal, Google it. It's a normal test. What do you mean? You know, I don't get it. I would be dangerous if I was able to, like, prescribe and, like, order tests and stuff like that. And I say dangerous, but I would be dangerous because I would be, like, taking people off of medications like quickly. that might not be good. I shouldn't say dangerous, but you know, like if I was able to prescribe meds, I would more likely take people off of them than put them on.
Right.
And then also the the nature of the diagnostic testing industry. Like I would be ordering the tests that nobody around here can do. So I'd be having to send stuff to Colorado and wherever because I'd be like, well, I've never ordered that test before. I don't know how to do that. Well, see, there's this list, and you check a box, and you tell the hospital this is what you want. Right. But I'll tell you why some of them don't want to do the testing, because they don't know what to do with the results. If they're not a specialist, like especially hormonally and glandularly, if they're not a specialist in endocrinology, they're very hesitant about ordering a test that they're going to have to read results and then identify a problem.
Right. That makes sense.
Because they're like, right? Because
do that again.
They don't handle it like a person who does that every day would handle it, you know. So
that which leads us right back to specialists.
And I'm just I'm on a kick today apparently, so I'm going to get off my soapbox with that.
I like that kick though.
Yeah.
And that's why I don't go to the doctor.
Right, but I don't want to be negative either because there's a time and a place. And when you need the testing, I want to be able to. And sometimes I have a really good rapport with the doctors in my area. So we share patients all the time. So, if I tell them, you need to go back to this doctor and you need to tell him you need this, this, and this done. Nowadays, people don't argue with me much.
Right.
5, 6, 7 years ago, they'd been like, who's this chiropractor telling us what we should do?
Right.
But nowadays, they're like, oh, Dr. Julia thinks you need this done? Well, yeah, let's go ahead and do that.
That's good.
Yeah.
I have one more doctor thing.
Okay.
So this weekend, Steve woke up at 4 o'clock in the morning writhing in pain.
Oh, I hate that for him.
And he's not a sissy. Mm-mm. And it ended up, so I Googled his symptoms.
It wasn't the knee.
No.
Okay.
I asked him a bunch of questions, Googled it, and it was either diverticulitis or a kidney stone.
That would cause, both of those would cause writhing.
Right.
Yeah.
And so he went to the hospital, and the doctors, he asked Steve a bunch of questions, and the doctor said it's either diverticulitis or a kidney stone. And then he asked him, and Steve actually said to the doctor, that's what my wife said. I was so proud of him.
That's so
cool. I know. And because he doesn't do that very often. And they just did. He asked him a couple other questions, and he said, my guess is it's a kidney stone. That's what it ended up being.
Wow.
And
now, has
okay
he had
now.
kidney stones in
Never.
the past? That is very strange. Honestly, that's strange. But I want to talk with you later because if I remember correctly, him and I were talking about calcium.
And you also were talking about cruciferous vegetables.
Yes, so we'll talk later because that should not have happened. If his calcium was being processed, he was drinking
too much coffee too.
Okay, if his calcium was being processed correctly, it wouldn't have developed a stone this late in the game. Like if he's not been hereditarily, genetically predisposed to creating stones, generally speaking, people who have kidney stones have had them and know that they're going to have them again. So for him to have it this late in the game, there's something off. So we got to talk.
Okay, good.
Let's save that for another time.
Okay. Thank you.
You're welcome. All right. So shall we talk about our topics?
Yes, please.
All right. So I always do my topic first.
Yes.
I want to do your topic first.
Oh, no.
She wasn't prepared.
No, I am.
Is it going? Hi, everybody.
So my topic is listening.
Oh, okay. Let's talk about listening.
Go ahead, I'll listen.
This was a trick. Stinker. It's a trick.
The reason I'm picking this is because it is an art. Listening is an art. Mm-hmm. And we all know people that don't listen.
I always say, you know how to listen, but you don't know how to hear.
Oh, I like that.
That's different.
And yet listening in itself is not always widespread. It's not. I don't know if you have a friend like this, but I have a friend, an acquaintance actually, that will be talking. She'll ask me a question, and she'll answer the question
Herself?
Yeah. While I'm talking.
Oh, no.
And then she gets, and like it, I don't know, it's the most frustrating thing. So I don't even say anything. I just let her talk.
Maybe that's all she wanted to begin with. There are people who do that, who just need to vent and don't really want your input, but they will walk themselves into their own answer.
Yeah, so don't ask. So, and in coaching, there are people that I don't just walk around giving out advice.
No, I wouldn't say that about you. I do that.
That's your job, though. But when people come in, when I'm coaching, it's really good for you to find your own answers.
Yes. And that's kind of what a good psychoanalyst will do, too. Psychologist.
Right.
They'll help you, guide you, but then you find your own.
And the way I do that is I ask a bunch of questions, and then you answer, and then all of a sudden, hopefully, you'll have an aha moment. However, I would say 60% of the time, we'll go through our whole hour session, and at the end of the session, they'll go back to the story that they walked in the door with.
What does that mean to you? What do you think happens? Like they didn't hear any of it?
It means...
So they're like, oh, yeah, I hear what you're saying. I know what you're saying, but this is what's going on.
And this is how I choose to live my life, not that way. It's like so frustrating. But it's okay because some of that had to have sunk in. As long as they're listening, and I can tell that they're listening, they may not be hearing, but they are listening. Something is bound to sink in. And a lot of times people have to think that it's their idea in order for it to work. And which is fine. Which is fine. I have no problem with that as long as they're making strides forward. But there are people, at a conference, everybody's at this conference. There's a keynote speaker that is phenomenal, and there'll be somebody texting on their cell phone.
And you're like, why are you even here? Why are you taking up space and pretending like you're here to learn when you're obviously not paying any attention? And this is what I'll hear from people like that. Oh, I can do several things at once. I can do my laundry list and play a crossword puzzle and listen to this guy at the same time. No, you can't. No, you can't. I'm a nervous system expert. And I'm going to tell you, the brain is super magnificent, but it does things linearly. So when you process things, you are not processing all those things at once. You're doing it one at a time, just super quick. Okay? So if that is the case, then no, you cannot do this, and be keeping up on all of it. Instead, what you're doing is you're making your brain jump from this one to this one to this one to this one to this, and then confusion sets in. And then the keynote speaker is talking about Tide laundry detergent in your head because you're thinking of your laundry while you're hearing him speak, while you're hearing this. And you see what I'm saying?
Right,
like your brain gets confused. So when people say, I'm a great multitasker, that's kind of bullshit. I mean, you might be really good at getting by, but you're not taking in everything that you should be taking in if you were to focus. Focus and clarity is where it's at.
Right. So what that person, I hate the word should, to get the most out of that situation, you would focus on that keynote speaker and take notes.
Mm-hmm.
And
some people don't
take notes.
But yeah, you'd have to focus and engage. See, I don't always take notes, but I always engage.
Right.
Like if they're speaking and I feel like that's something that I agree with, I'm like, yeah. And then I'm like, oh, and I'm engaging.
But
I'm
you
reacting.
have a better memory than I do, I think.
Yeah, but that doesn't really matter. That doesn't.
She does.
Shut up, Patrick.
But, I mean,
Patrick's
the way
giggling.
I learn is